Good afternoon, everyone. Welcome to our webinar. Our webinar today is called Travel Insurance and the Pandemic, and we appreciate you taking the time to join us. The presentation is being presented by myself, Laurie York, and Pam Langevin, my colleague.
Hi, everybody.
Okay, so before we start, just a couple of funnies. This one is pretty funny because it's not, hopefully it wouldn't happen, but if grandma really did get run over by a reindeer, you would want to have coverage for her if that happened in the US or wherever your travels might take you. Getting older is like visiting an all-you-can-eat buffet. What should be hot is cold, what should be firm is limp, and the buns are bigger than anything else on the menu.
Way too relatable.
Yep. I'm so old, I can remember getting through an entire day without taking a picture of anything. Do you relate to that, Pam?
I can. Well, I can. Although I am a fan of photography, but I can.
Okay, so the agenda for today, we're going to do the formal introductions, like I mentioned. We're going to talk about COVID coverage. We're going to talk about traveling during the pandemic, and we're going to be talking about vaccinations and how that affects your coverage as well if you were to travel during the pandemic. So we'll start with myself. My name is Laurie York. I've been in the insurance industry my entire career. I worked at a number of different insurance companies, and I've been with Medi-Quote insurance brokers for 15 years. So I've had my 15th anniversary this summer. And before that, I worked at a travel insurance company for 5 years. So lots of experience in the travel insurance industry specifically. My colleague Pam is also a senior broker. We're both senior brokers at Medi-Quote. She joined Medi-Quote in 2010. And before that, she was in the insurance industry for 5 years. And she also is in charge of training new brokers that join Medi-Quote. So thanks for joining us today, Pam.
Absolutely.
Matt, who's hiding behind his name on the tile there, is our welcome, Matt, and he is our IT and marketing team leader. Joined Medi-Quote in 2010. He does our newsletters, our website stuff. He's going to make sure everything runs smoothly here today. Okay, so about Medi-Quote. So Medi-Quote Insurance Brokers has been providing travel medical insurance as an independent travel insurance brokerage firm since 1994. That's a long time. And we provide our clients with an unbiased perspective on a varied range of travel and medical insurance products. So our mantra to you is that we get you the best coverage at the best price. Okay, so traveling during the pandemic. So the travel advisory was called on March 13th, 2020, Friday the 13th. I won't forget that day.
Big day.
For a long time. And going on 9 months, it's actually more than 9 months now, closer to 10 months. It is still in effect, and it affects coverage for the reason that the travel advisory was called, which was COVID, on travel insurance policies. So it's very important to realize that everything changed on that day regarding travel insurance. So 9 months into the travel advisory, land borders remain closed, but air travel is permitted. So there's lots of planes flying in the skies, taking people to different places, but obviously things have changed. And of course, you can't take your car down there. So that is a bit of a problem for people as well. We'll talk about that. So you can fly. Amazingly enough, you can fly anywhere. Well, I shouldn't say absolutely anywhere, but there's lots of places that Air Canada is flying. They have this I got this off of their website, this link here. And basically, they're trying to make people feel comfortable in booking flights so that you will still fly during the pandemic. So they have this new cleaning thing that they do, and it really is a lot of effort that they're putting into that. And then they have flexible booking options. So you can cancel your flight and you can change it without penalties and that type of thing. So that is definitely some new stuff for Air Canada. WestJet also has some of the same stuff. They also have a no charge COVID-19 travel insurance. So if you book a flight with WestJet, and this goes for Air Canada as well, has the same thing, but they will actually cover you for COVID-19 if you should have, happen to contract COVID-19 on your trip. Sunwing is the same, and they have COVID coverage as well. But there are a lot of fine print to those policies. So you do have to be careful that you can't just assume it will cover everybody. It's not going to cover everybody. In fact, there's different things that you need to know. So most coverage now, this says ending November 30th. I'm pretty sure they've extended this, but it could end at any time. And it's only a $200,000 maximum, and it's only if your trip is under a certain number of days. So it's not really going to work for people who are going on long trips. And not to mention that the maximum is pretty low. So the airline coverage is free. You don't even qualify for coverage unless your trip is 21 days or less. So that means that basically if your trip is more than 21 days, you can't count on this coverage for the first 21 days and then just add COVID coverage on to that. You just don't have coverage for your trip if it's more than 21 days. And the maximum is $200,000. And again, another example of how the airlines are trying to make it easier for you to travel. They've arranged a testing agreement with Hawaii. So if you, I believe it is, if you fly through Calgary to Hawaii, you can get a test in Calgary and land in Hawaii without having to quarantine. And then here's Air Canada's website as well for that same thing. And then some people got creative and decided to ship their cars across the border and then fly down to catch them or to greet them, to meet them, whatever. And so that, I think there are a number of people who've done that. We did a little bit of legwork on that as well. And here are some companies that transport cars into the US. The prices are not cheap, but it is an option if that's something that you're interested in. Vaccinations, as popular as the Rolling Stone. So this news article seemed to say that vaccinations are very popular. And apparently in the US, in Florida, this article indicates that there's no proof of citizenship required. They're just giving the vaccination to anyone that's over the age of 65, trying to get the population vaccinated. So it is possible that you could go down there and actually get vaccinated quicker than if you were to wait and have it done in Canada. Starting January 7th, we had the Government of Canada required a negative test results for air travelers coming into Canada from any other country. So they have to get tested where they are, and then they don't get let on the plane unless they have this negative test result. So that is something that's relatively new. I think it's getting people a little bit frazzled because they don't know where to go to get this, and their flight's coming and stuff like that. So it was really done on the fly. And so it's going to need to, hopefully you're going to be able to have more places to get that done in the future so that you can seamlessly do that and get back to Canada. And there was just this news article came out yesterday, I believe, and this is the requirement that air passengers entering the US must have a negative COVID test. So now you've got to do it on both ends. So before you enter the US, you have to get a negative COVID test, and then also on the way back. So that is pretty new as well. And then there's this Arrive Can phone app, and that is, this is just a news article about that, but basically so that you can track your quarantine, that maybe the government can track your quarantine, because that is a requirement. So once you know that you're going to travel, then you need to decide how much is enough COVID coverage. So we sampled a range of our clients to find out what they thought would be the right amount of coverage. So you can see there that most people thought that $1 million of coverage would be enough, although some people thought that 2 million or 5 million would be better than 1 million. Not a lot of people said lower than that, but it is a personal decision. There's lots of options available, that's for sure. So Pam and I feel that $1 million is good, 2 million is better, more than 2 million is even better. And the question becomes, Pam, what is the price?
Well, the price is not actually impacted by the level of coverage quite often. You could have a policy that offers $200,000 in coverage, and it could be more expensive than one that offers $1 million. Insurance companies use so many factors to determine pricing. They look at your age, the length of time you're away, and your health. And that's what determines your pricing. So it varies greatly from person to person, and then from traveler to traveler based on time.
Mm-hmm. Yeah, so just on that note, like travel insurance goes up every year, and that is, we've seen that forever and ever. The US medical inflation is, historically quite high. It's actually higher than regular cost of living inflation, and that's why they've given it its own category. So US medical inflation affects travel insurance prices. You could move up to the next age bracket, and that would make your price go up. You could have a worsening of your health, so you have to answer yes to more questions on the medical questionnaire. And then when you add COVID coverage onto that, which is kind of like 10% ish in terms of the surcharge for that, it could cost a lot. But like Pam said, it's not like it's 10% for 1 million, 15% for 2 million. It doesn't work that way.
Right.
Sometimes a higher amount could be a cheaper price because that insurance company just charges a cheaper price.
Exactly.
Okay, so we're going to give you some questions and answers now. So if we had a live audience, we would ask questions, but we can't ask those questions. So what we did is we took a whole bunch of frequently asked questions, so questions that people had asked in the past, and we have put them here. We're going to answer them for you so that you can hopefully get the benefit of all of those frequently asked questions. So I'm going to pass it over to Pam, and she is going to take over.
All right, so very common question. I already have an annual plan that I paid for that doesn't expire for a few months. Can I use that? So currently annual plans have two types of exclusions that address the travel advisory, and you have to look at your specific policy to determine which clause you have. The first type of clause is one that says that your travel to a country, region, or city for which the Canadian government has issued an official travel advisory to avoid all travel or to avoid non-essential travel regarding the country, region, or city of your destination before your departure date. If the travel advisory is issued after your departure date, this exclusion does not apply for claims for an emergency or a medical condition unrelated to the travel advisory. So if you have this clause and you travel, even though that travel advisory is in place, you would have coverage for anything unrelated to the reason for that travel advisory. So currently that is COVID. So the policy would cover you if you fell and broke your arm, but it wouldn't cover you if you ended up testing positive for COVID and needed medical care. The second type of travel advisory clause says that you're not covered for any act of terrorism or medical condition you suffer or contract when official travel advisory issued by the Canadian government states avoid all non essential travel or avoid all travel regarding the country, region, or city of your destination before your effective date. This exclusion does not apply to claims for an emergency or medical condition unrelated to the travel advisory. Um, so, one type says that you don't have coverage at all, even if you travel to that destination, and the other advisory states that you have coverage as long as it's not related to that travel advisory. Again, each policy is specific, and what you want to do is read it. Now, if you're not sure how to interpret that travel advisory, by all means, give us a call, let us know, and we'll help you do that.
And in fact, this clause here, you actually can't travel on this policy at all, because it says specifically that the travel advisory was issued before your effective date. And so if you have an annual plan that's already in effect, like you just don't have coverage at
No,
all for
it's
anything.
not going to cover you for anything.
Yeah, so you just need to buy something new that's going to cover you. And I mean, basically, these policies were written, long before the Canadian government issued the travel advisory advising Canadians not to travel anywhere outside of Canada. And they were not written, even fathoming that could even ever happen. So
No,
it's
certainly a worldwide,
pandemic was not in the
not
cards.
envisioned on anybody's radar. Now, if you're not sure where or how to determine that, the Canadian government does have a website. So you go to the website, and normally you would key in your destination, and the travel advisory, if there was any, would then appear for you. So as you can see by this information here, currently the travel advisory is issued basically worldwide to avoid non-essential travel outside of Canada until further notice. So hopefully further notice is shorter rather than longer, but we don't know. So I need to buy a policy, and what coverage is out there to purchase? So up until July, there were absolutely no options. Insurance companies were very gun shy when it came to offering coverage. They weren't sure how this was all going to play out, so we had nothing that we were able to offer you. Now, in September, a few insurance companies did come up with some options, and we were able to find you some coverage. And very, very quickly by October, we then had 4 options that offer COVID benefits, and again to varying degrees. So by October, several insurance companies followed suit and were able to offer benefits. But not all policies are created equal, so you do have to watch. Now we have the economy or Hyundai version, and as Lori likes to say, we're not slamming Hyundais, but back in the day, they were the economy class. Now this policy will have no exclusion for COVID specifically. So it simply means that they'll cover it, but you won't find anywhere in the policy wording that it states that they cover COVID. It'll just be a policy that does not have an exclusion, and it's the most basic coverage and does offer coverage to the full policy maximum. The mid-class version, or the Chevy version, does offer COVID or pandemic endorsement that specifically allows for coverage for anything related to COVID. It does have a few extra perks and possibly a limited maximum for the COVID. So that policy is going to offer you coverage, and you will find an addendum to the policy explaining that the coverage is there for you. So it's a bit better worded for you. And finally, the luxury model or Cadillac version. This offers a $5 million coverage with no 10-day limit to get home. So, if for some reason the travel advisory was lifted and then instituted again after you departed, you wouldn't be required to get home in 10 days. The coverage is for hospital and physician costs due to COVID, whether or not there is a travel advisory in effect at the time of your departure. So, again, what they're saying is that even though their travel advisory is there, they're offering that coverage anyway. In addition, there's a quarantine benefit on this type of policy that can be very useful. So the policy will extend and offer up to $100 per day to a maximum of $1,400 for necessary expenses at destination. And that's when you quarantine but aren't hospitalized. It'll also provide up to a maximum of $500 for perishable items, either groceries or takeout food orders delivered to you during your quarantine period, and up to a maximum of $100 for taxi fares to and from a COVID testing center. Again, all designed to help you through that quarantine period to get you well and get you home. And if you are in the United States, they will also give you access to virtual consultations with a physician. Um, Again, it will be an automatic extension of your policy for the quarantine period up to a maximum of 14 days. And then once that quarantine period is over, an additional 72 hours to give you time to get home. So that benefit, especially with the requirement to have a negative COVID test prior to returning to Canada, could be very beneficial. So, what would I have coverage for? Your emergency medical policy will cover you for what is medically necessary to treat you at your destination, and that includes doctor's visits, hospital visits, a hospital stay, ICU, ventilators, medications, anything that you need to deal with that medical situation. Specific scenarios are hard to answer because these are such unprecedented times, aren't they, Lori?
They certainly are. We have our company issued mugs that say this.
Uh,
But it is important to note that all of those same benefits it would cover you for COVID as well if you caught COVID while you were traveling.
exactly. Am I eligible and how do I qualify? So, different companies have different eligibility and rating criteria. Um, what we do is we take a look at all the options for you. And of course, the richer the benefits, the tighter the qualifying criteria will be. Um, so you're going to see what we call upfront underwriting. And this is where the insurance companies ask all the regular questions about your heart, lungs, diabetes, stroke, any medical conditions you might have. You will also be asked to provide your destination, height, weight, if you're on any immunosuppressive medications, and corticosteroids. Some of those questions are a little bit different and they deal directly with how COVID is found to impact individuals who have some of those medications that they're asking about. So, back end underwriting is when the insurance company starts to ask questions at the time of claim. So, these are questions that aren't required to be answered prior to your departure, but once you have a claim, they may ask you questions such as, is there or was there a quarantine requirement imposed at your destination? So if there is, that is something that you want to, when you're getting a policy or getting a quote, determine if that type of quarantine requirement will impact your policy and your coverage while you're away.
Mhm.
And that's because we do have a policy that has what we call a quarantine exclusion. So the exclusion reads, benefits are not payable under this policy if losses sustained or expenses incurred are the direct or indirect result of any of the following four: any eligible expenses incurred as a result of sickness while under a mandatory or suggested quarantine upon arrival. This exclusion applies if the expenses are directly or indirectly related to the reason for the quarantine. So if this policy exists, or if this clause exists in your policy and you had to quarantine, you would not be covered for the period of the quarantine for COVID. So you may have to look at additional coverage or a separate policy. All right, rapid fire Q&A. Are you ready, Lori?
Ready.
Okay, do the COVID plans include regular emergency medical coverage or just coverage for COVID?
Well, that's a good question. I mean, we offer both. So some of our plans offer regular medical coverage, including COVID, and some of them are, well, they should be priced lower because they're just offering coverage for COVID. I can't guarantee they're priced lower because sometimes I've noticed they aren't lower, but they only cover COVID. So you have to be a little bit careful. Does the cost of COVID coverage change based on the destination country? What about the United States?
Well, we have a couple of different options, and one of them does take into consideration your destination. And they will do, if it is the United States, the costing based on your destination state. So if you're going to Florida, the cost may be different than if someone else with the exact same medical conditions and age was going to South Carolina. So it is impacting the pricing. If I test positive for COVID while at my destination, will I be flown home?
Yeah, I mean, this is a fairly significant question that we are asked a lot, and it really is hard to know. Typically, the insurance company will do whatever it is that is medically necessary to treat you while you're there, and if the treating doctor says that, in his opinion, it would be better for you to be flown home, you're stable enough to fly home, then typically the insurance company would fly you home, to continue your treatment at home rather than staying in the US or wherever you are. Okay, if I get the vaccination while in the US and I have an adverse reaction, will that be covered? I've had that a million times, that question.
We have. And it's going to depend on which insurance policy you have and which insurance company you're dealing with and what their decision has been. We had some insurance companies say that no, if you had the vaccine and had an adverse reaction, that would not be covered. And still others have made the decision that you are trying to prevent further illness. So while the cost of the vaccination itself will not be covered, if you did have an adverse reaction, that would still be covered. And again, the regular terms of the policy still apply. But if you were to get a rash or you needed some medical care due to an adverse reaction, for some policies it would be covered. If you have to cancel before departure, will the price of the policy be refunded, Lori?
Yeah, I mean, the insurance companies have taken a very lenient approach. They've said, look, buy your policy, but if you need to cancel, you'll get a full refund. So that's been the normal policy that we've always had. Does trip cancellation insurance cover COVID, Pam?
Well, again, it depends on the policy. We do have one that says as long as you've purchased the policy prior to departure and there's no evidence that you have COVID, it would cover if you had to cancel due to COVID being the reason. And yet other policies have stated no, they're simply not covering any cancellation due to COVID. So again, each policy is different and it's important to ask those questions when you're looking for a quote.
Yeah, we're not selling a lot of trip cancellation insurance these days because of all the flexibility that the airlines are giving. Even like I've heard Airbnb is being flexible with canceling as well. So
Yeah, I think everybody's realizing that they have to make some changes and considerations in this
During the pandemic, yeah, exactly.
situation. If you have COVID coverage, are you guaranteed to get into a hospital?
Yeah, well, I think that nothing's guaranteed during COVID, but I think that if you have COVID coverage, you're considered a paying customer to a US hospital in particular, and they would get you in if they could. If they can't get you in, um, you know, I don't know what would happen in that situation, but I do understand that there are hospitals that are getting close to being full in Canada and in the US. So we're going to find that out soon. Okay, if you test positive for COVID, would Canadians be treated as a lower priority next to Americans getting medical care?
Well, in America, in the United States, hospitals are big business, and I think if you're a paying customer, you're a paying customer. I don't think that they're going to limit accessibility to care based on your citizenship. I mean, currently, if you are a Canadian citizen and you're down south, they are making the vaccine available to Canadians as well. So in my humble opinion, I don't think that Canadians would be treated as a lower priority. I think it's just going to come down to availability of that medical care.
I agree. I agree.
What is the cost for an ICU stay for COVID?
Yeah, that's a tough one. I mean, it depends again on what services that you need because everything is billed separately in the US. But if you need to have a hospital stay, if you need to be in the intensive care unit, there's more nurses around, there's more doctors around. There's ventilators, there, all the stuff that you would need to treat you if you were staying in the intensive care unit, and it can be quite expensive by the time you add all of that stuff up. I mean, I would venture a guess at least in the hundreds of thousands of dollars. Okay, once I get the vaccine, would you suggest still buying COVID insurance?
Personally, yes. There's some research data Matt has diligently applied to this slide for you. So it takes time for the full effect and protection to be garnered. So you have to wait some time. You do need 2 doses from what I understand. And, um, you know, it's 95 or 94.5% effective. So there still is a chance. Um, Certainly, I would absolutely recommend getting a quote for both with and without the coverage and making your decision. Because if the price difference isn't that high, why wouldn't you get more coverage rather than less? Um, there have been individuals who have had COVID who have had a recurrence, so personally I wouldn't hesitate to still get that COVID insurance even though you've had the vaccine.
Yeah, I agree.
Things to remember. Rules are changing very rapidly. um I
It's an
miss the
understatement.
days. I miss the days when we knew what was going on. Okay. And some prices change based on the incident rate at your destination. The only way to lock in your price in these instances is to pay for your policy. Leaving the quote and paying later will definitely result in a different price. Insurance companies, as Lori said, are being very wonderful in that if you have to purchase a policy and you need to make date changes, there's no administration of fees applied if you have to make those date changes. And if you have to cancel, as long as you let us know before the effective date, you do get a full refund. So they're taking a very no risk approach to purchasing that policy early. So apply for it, get it, lock it in your price, and if we have to change it, we will.
Exactly.
And the final word about trip cancellation insurance. Trip cancellation will not cover you for COVID. All insurance companies are considering it a known risk and will not provide coverage for trips booked in the future. Um, if you got a credit from your travel supplier in March, then you should be able to rebook your trip cancellation policy on your new trip. So definitely, if you've had a policy in the past and you've gotten a refund from your travel supplier and are looking to book a second trip, let us know and we'll change the date.
Yeah, so this was all about like trip cancellation insurance that you had purchased before your like before COVID was a
Before
thing.
March.
Yeah, before March. So a lot of people, I mean, we talked to a lot of people that basically said, like, I have this trip cancellation policy and my trip is canceled because of COVID. Can I use it? And you know, there was just a lot of people like questioning that. And basically, if you're, unless you got a full refund from the airline or travel supplier, whatever travel supplier, you couldn't get your money back for your trip cancellation insurance. But if you didn't get a full refund, you couldn't actually use your trip cancellation insurance either. So it was really just a matter of the only thing that we could do is rebook your trip cancellation insurance for a future trip. So you should check that out. If that applies to you, you should check it out.
Absolutely.
And that's it. That's the end of our presentation. So thank you very much for attending. We appreciate you taking the time. Our website address is there. You can get a quote online by going to mymediquote.ca, or you can call us for a quote. So thank you very much for joining us today. And thank you, Pam, for doing this with me. We really appreciate you guys watching us.
Absolutely.
Bye.
Bye, everyone.